Hi, my name is Rob Gent, and I'm the clinical director here at CALO. We're a residential facility that specializes in the treatment of attachment and trauma with adolescents, 13 to 18. Love to do a presentation with myself, a outpatient therapist, and a young woman who was a client of ours, and she was able to take this journey with me of coming into specialized residential treatment care, focusing on attachment therapy, and being able to actually transition to the home environment, back into that environment, developing a relationship with an outpatient therapist, and experiencing a tremendous amount of success. The title of the presentation is Success in Attachment Therapy, Experiencing a Young Woman's Journey from Trauma to Interdependence, from Specialized Residential Care to Current Outpatient Treatment. I said I would be the primary presenter. My name is Rob Gent. I'm the clinical director, along with Stephanie Shelley. She is an outpatient therapist in the Boston area who's certified in DDP, which is an attachment-focused therapy modality, along with Ashley Crush, who is was a student here, who is the actual child going through the journey herself. The presentation highlights would really focus on the unique experience of having two therapists along with the client, and being able to walk through all the experiences, all the interventions that were good, that were bad, that worked, helping to create this dynamic where the audience gets to experience that there is success with doing attachment therapy. It can be a rough road, but with her, she's a living example to get that firsthand experience of some of her success. Part of the presentation would certainly educate on attachment principles, teaching the audience what are some of those fundamentals of attachment therapy, and what does that look like to be effective, and understand the principles of understanding shame and those core beliefs, not just focusing on behaviors and how these students often recreate shame. We would talk about attachment therapy and interventions, the experience in the process of transition, tremendous highs and lows of being at home, and working through developing self-concept. How do I continue to receive support? How do I work with my therapist? How do I develop a relationship? And oftentimes that's push and pull. And certainly looking at where she's at now. What is her current state of functioning and success? And seeing her in college, and she's a functioning college student, actually wanting to be a therapist herself, having a close relationship with her mother. Very rewarding to see. And lastly, it would be to really reflect on her future goals and see how we as attachment therapists are learning to grow and learning what's effective. So that is our presentation, and we look forward to being able to do that. Thank you very much.